Hi, this is Dr. Beltre from Beltre Bariatrics. I am a bariatric surgeon in the area of Orlando, Florida. And I'm going to make a quick video about folic acid or folate deficiency in bariatric patients. Really, this video I should have combined it with my vitamin B12 deficiency video. I have made a previous video explaining vitamin B12 deficiency in bariatric patients, so you guys can look for it. And basically, the reason I'm saying I should have combined both is because vitamin B12 and folic acid or vitamin B9 work very close together. In addition to working very close together, they come from very similar sources, and their deficiency symptoms are very, very similar as well. Like I said before, folate or folic acid is also known as vitamin B9. Okay, it's one of the building blocks necessary for human cell growth and health. It helps create red blood cells, which also have to do with the immune system, also nerve cells as well. Folic acid or vitamin B9 can be found in many common foods, including breads, legumes, cereal, flour, pasta, rice, lean meats, eggs, nuts, seeds, and soy products. So you can see that it's actually pretty commonly in the foods that we normally consume. Symptoms of deficiency of vitamin B9 or folic acid is very similar to a deficiency of vitamin B12 actually. You have anemia and psychiatric and neurological issues, depression and neuropathies, joint pain, lack of energy, hair loss, and glossitis, which is inflammation or redness of the tongue. Again, very similar to your vitamin B12 deficiency. The recommended dose for bariatric patients anywhere between 400 to 800 micrograms. Women of childbearing age, however, that are thinking of getting pregnant, they should be taking anywhere between 800 to 1,000 micrograms daily of the folic acid or vitamin B9. Just to give you an example here, this is a bariatric multivitamins, and I know my the screen kind of covers some of it, but this is the recommendation for the ASMBS. But I also want to show what one of the more commonly used bariatric multivitamin, how much does she have? Remember that the recommendation from the ASMBS is anywhere between 800, 1,000 micrograms. This particular brand has 1,333 micrograms of the folic acid, which is like 333%, a lot more than what is needed. This is why I like bariatric multivitamins, by the way. And most bariatric multivitamins do have this amount. This particular one, I believe, happened to be Celebrate. I don't endorse, by the way, any multivitamins. I don't get paid by any vitamin companies or anything like that. This happened to be one that I use in my patients. I have other brands that I use. I happen to have a picture of this, of what it contained. But I can tell you that pretty much all of them contain pretty much the same thing. You just find the one that you like. But anyways, as you can see, they do put plenty of folic acid or vitamin B9 in there, so that very hard to really become deficiency if you're having a balanced diet and you are taking your multivitamins. Well, what if you are deficient? If someone is deficient, then the recommendation is 1 milligram daily to correct the deficiency of the folic acid or the vitamin B9. So if you are found deficient, 1 milligram daily should be the dose. And by the way, if you notice, the multivitamin that I just showed had a lot more. It has like 1.3 milligrams, so a lot more than what you need. So again, this is why I much rather my patient take a bariatric multivitamin and not the regular over-the-counter multivitamins, because they're going to have a lot less of the folic acid. But that's the recommendation if you are deficient. And then, of course, once you correct the deficiency, then you can go back to taking your 800-900 daily dose. By the way, vitamin B9 or folic acid deficiency, it's I don't want to say it's rare. I do see it once in a while in my patients, both male and females. It happens, but you don't see it very frequently though. If someone has a balanced diet and they're taking a good multivitamin, they should not really be deficiencies in folic acid, because like I said, this deficiency is very rare. I hope this video has been of help for for those that have had surgery, those that are thinking of having bariatric surgery. Again, this is Dr. Beltre from Beltre Bariatrics. I am a bariatric surgeon in the area of Orlando, Florida. Thank you, and see you soon in the next video.